Diane, why don't I just have you take it away and we'll go from there.
Great, thank you. I'm Diane Brogan-Habash, and I am the Associate Director of Education. So I design educational things for integrative medicine, and I have certification as a dietitian as well, which you'll hear a little bit about today. I'll pass it over now to Leah.
Hi, I am Dr. Leah Welsh. I am one of the physicians at the Center for Integrative Medicine. I did my residency training in family medicine with a curricular tract into integrative medicine. And then I did a fellowship to specialize in osteopathic manipulation, which I will talk your ears off about.
Go ahead, Laurel.
Hi, my name is Laurel Colombini, and I am the Associate Director at Integrative Medicine. So I help these lovely ladies and about 24 others facilitate and practice integrative medicine within Ohio State.
All right. So shall I share my screen? Yeah.
Yeah, let's go ahead. Yep.
All right, let me find it here. Hang on just a sec. Everybody can see that? Can you give me a thumbs up? Yes. Awesome. Okay. So Dr. Welsh and I are going to walk through about 15 slides and explain what we have found for you that has to do with traumatic brain injury. Next week, our licensed massage therapist, Ted Bluba, and our nurse practitioner, Jess Henning, will be here presenting more practical and actually experiences for you to see. So hopefully you'll be able to enjoy that. One of the things I want to say about this is that we're going to present from what we found in the literature. And part of that means that we want you to keep that in mind. It's what's in the literature, what's in the scientific literature around the integrative medicine therapies, or complementary and alternative therapies, they're also called. But I want to say a little bit about what integrative medicine is so you have a perspective on it. So this is kind of a busy slide, but basically the definition of integrative medicine, it actually comes from the National Institutes of Health, guys. This is a place where our tax dollars go to support the science that's done around the country. And integrative medicine actually combines all of medicine, everything that you know as conventional medicine, with complementary and alternative therapies together to treat the whole person in their environment. That's the ideal. And that's the place where we come from, okay? The scope of it really covers what we now recognize as two major areas: mind-body therapies and body-based therapies. And we will go into detail about that, but it even includes ancient medicines like Ayurveda and traditional Chinese medicine, and always with scientific evidence, okay? Now, the underlying theme here is that when we are trained in this, we're trained in patient-centered partnership with your provider. The goal is to look at each patient as a body, a mind, and a spirit, not just the body. So we like to get that out there ahead of time so you have a sense of it. When we first talked to Cater and his folks, these are some of the things that we heard were major challenges for traumatic brain injury and other neuro-related injuries. Pain, of course, different kinds of pain, not just headache, many different kinds of pain. Spasticity, range of motion, stress, depression, anxiety, and so on. When we looked in the literature, in the science literature, to find out what was being studied for TBI in humans, these are some of the therapies under integrative medicine that are currently being studied. And when we go through these slides, you'll see that not even each of these is being studied in humans. Sometimes it's studied in animals, okay? Now, you asked some questions, sent back some questions to us about reflexology and music and art therapy, and we'll actually have something to say about that. So here we go. I'm going to pass this over to Dr. Welsh to begin talking about osteopathic manipulation. And you're muted. There you go.
All right. So my practice focuses and centers mainly on the application of an osteopathic approach and using a lot of osteopathic manipulation. Osteopathic manipulation, just as a kind of shorthand definition, is a set of hands-on techniques that are used by osteopathic physicians to diagnose, treat, and prevent illness or injury, using techniques that usually include stretching or gentle pressure and resistance. And this is a definition from the American Osteopathic Association. Osteopathic medicine is the best. I am going to focus this little slide. It's just as an introduction. There's a lot that I know and have experienced in patient interaction and my training about an osteopathic approach to complaints. There is starting to be some literature specifically looking at the overlap of what Western medicine can say and publish about the application of this body therapy to patients within the brain injury patient population. And I'll go through a couple of summaries of recent studies in the literature that bring those two worlds together. The other thing that's really exciting to me about this is the literature that's out there right now shows a lot of promise for the application of this therapy, as well as a lot of places where research can kind of continue to grow. So I think that will be, I don't know, that it's an exciting place for me to be working with patients that have these concerns and symptoms. In 2013, there was a case series looking at a small sample of veterans that had mild TBI exposure or injury in their history. And the study looked at the associated symptom of a specific cervicogenic headache that improved in both frequency and intensity after the application of osteopathic manipulation, both in specific sessions and over the course of several sessions. In 2015, there was a retrospective records review study that looked at a much larger swath of post-concussive symptoms in athletes experiencing sports injury, symptoms such as headache, photophobia, brain fog, fatigue, that again decreased in both intensity and frequency of those symptoms after the application of osteopathic manipulation. And then in 2016, there was a case report detailing improvement in somatic dysfunction. Somatic dysfunction is an osteopathic vocabulary term that describes a mechanical restriction that affects the self-regulatory homeostatic processes that block or impede normal healing processes of the body. So this case report looked at various somatic dysfunctions, as well as patient-reported symptoms of dizziness, weakness, signs of cerebral edema in 2 traumatic brain injury patients that showed improvement in symptoms. And I think this is a theme that will come up a few times in our talk today and next week as well, with no adverse effects associated with treatment. And I think one of the things that has really drawn me into the complementary and alternative aspects of integrative medicine is that a lot of the therapies and techniques are and have continued to be shown to be very safe. sometimes efficacy is plus or minus, and that kind of looks at some things work for some patients. Yoga works for some patients, doesn't work for all patients, etc. But overall, the therapies that are under investigation and available at our clinic are safe. I also looked through this small sample of case reports and case studies detailed in their discussion again and again that the proposed and historically supported mechanisms of how osteopathic manipulation is applied and what happens in bodies with that application is that this is a therapy that improves blood flow into an area of restriction or somatic dysfunction and helps that neighborhood of restriction also drain metabolic waste products out of an area that is actively trying to heal and recover. It's also a therapy that is rooted in the idea that the body has innate healing mechanisms, and this therapy helps to support those mechanisms. Can we go to the next slide? All right, I really am a talker and I will not be able to say everything that really makes me excited about this slide. So I'll do a couple of bullet points. I wanted to say a couple of things about how osteopaths are trained to look at concerns, complaints, and these are lenses. These 5 columns represent lenses through which an osteopathic physician can kind of think about a problem. And I think hopefully everyone in the audience will be able to see the relevance of this approach to a brain injury patient population. So thinking about, I think most people who know a little bit about osteopathic manipulation think a lot about, oh, well, that's addressing tight muscles. And looking at a problem from a biomechanic point of view, you really have to know a lot about the anatomy and the knowledge, the reciprocal interactions of different neighborhoods of the body in the musculoskeletal system. A respiratory circulatory lens, again, kind of refers back to that idea of if a neighborhood of injury, either at the central nervous system or how the central nervous system is communicating to the peripheral nervous system, if there's not good blood flow bringing oxygen and nutrients in, if there's not good lymphatic drainage out of that neighborhood, that restriction isn't going to do as good of a job as healing, and manipulation seeks to address that irrigation problem using hands-on address. I'm going to skip to neurologic just because I think it's so relevant, looking at secondary symptomatic expressions of brain injury in bodies, thinking about how nociception and pain can influence especially the autonomic nervous system, which controls, among other things, how well blood flow comes out into the periphery, how well local smooth and striated muscles do their jobs, which is a large role in the peristalsis of the digestive system, so how we nourish the rest of the system. Really thinking about how to address and support that autonomic nervous system through decreasing stress on the musculoskeletal system is one of the ways that osteopathic manipulation has been proposed to help decrease stress and symptomatology of brain injury patients. And then looking at things from a behavioral medicine type lens, the psychologic, cultural, socioeconomic environments in which we live literally influence how we feel and are able to express movement and health in our bodies. So not thinking about that lens kind of comes at the detriment of a patient population. And I think that's something that we can do really well at the Center for Integrative Medicine. I'm going to say a couple of things about this slide. I also have my physician's acupuncture certification, and it would be silly of me to compare my skills and training with our two expert acupuncture and traditional Chinese medicine physicians, Dr. Wang and Dr. Zhang at the clinic. But I do utilize a little bit of acupuncture in my practice, and some of the things that Western medicine has been able to reductionistically start to understand about how acupuncture can help symptoms is that it's based on the idea that there are channels of energy through the body, which actually correlate very well to fascial lines of tension that body workers utilize in their practices. And there's some really interesting evidence that's starting to look at what kinds of chemicals and hormones that are released that suppress the subjective experience of pain following acupuncture application, as well as the increase in some endorphins that help to promote feelings of well-being. So that's some of the like scientific understanding of how acupuncture works for some folks. In terms of what is known about how acupuncture and TBI, how they interact, research is ripe for exploring. But there are some cool pieces in the literature that shows acupuncture can really help support decrease of symptoms such as headache, pain, and spasticity, helping folks work through the experience of PTSD, as well as some osteoarthritic, low back pain, headache, other symptoms that might be relevant to this patient population. Dan, do you want me to continue talking? Would you like to say?
I'm happy to go if you'd like. Let me.
You go ahead. I feel like I'm talking a lot.
No worries. So one of the things that we want to do, though, as we proceed through the next several slides, is that Dr. Welsh and I, and perhaps even Laurel, might chime in at different times to say things. We're really just going to look at a few other things and give you some science and give you some understanding of the impact of these. When I looked in the literature for therapeutic massage for TBI, and I call it TBI plus, folks, because it's not just TBI, it's many of the other things that come from or in addition to the concussive kinds of things or stroke or whatever, but I call it TBI plus. And all of the literature is listed either on the slides or at the very end. Most of the literature that came up or surfaced for massage and reflexology really related to migraine headaches. And there really aren't that many studies that are available. Again, and you're going to see this again and again. And as Dr. Welsh alludes, it's a great opportunity for a significant amount of research to be done. And most of the time, let me just say this about this research, because it hasn't yet been said. When research studies are done in TBI populations, what the researcher has to do is they have to confine the population to make them as similar, only choose people as similar as possible to each other, simply because, as you know, patients with TBI have many different kinds of things happening. And so the researcher has to confine it. So if they want to prove something works, they have a confined and very similar population for testing, which really is good in a way because it can show impact, bad in a way because it doesn't include everybody. It just includes a select.
It's a lot of people out. Yeah, that's a good point.
So know that going into this. in a couple of studies, and actually a lot of times they put studies together and they look at them. It's called a meta-analysis, and they'll look at how well these studies did, but they have to be really well done studies with control groups and so on. And so I got to tell you, fishing through this to try and get an understanding, it gave me the appreciation that we don't know enough. But basically, when using therapeutic massage, there is some help for migraine, especially. We know that's the fact for non-TBI patients, and there is starting to mount some evidence now that it is helpful for TBI related injuries. But again, very few well-controlled studies. And notice that in this second bullet, fewer migraine days per month, and actually less analgesic or less pain med required. So that particular trial was helpful. As far as reflexology, there really is very limited information. There's one study that showed that when it was compared to sham, which means you fake that you're doing something, versus not treating, there were improvements in migraine, less migraine pain actually for the reflexology group. And notice that it was only 2 20-minute massages separated by 3 hours in that particular study. So for that particular methodology, there seemed to be some reaction immediately. In other words, it didn't take 8 weeks for things to happen. Now, the massage therapist that will talk to you next week, Ted Blubaugh, he gave me the link here at the bottom of this slide. And he uses this all the time with patients, and it focuses in on muscle groups and lets the patient help to isolate or locate the problem. And this is what they use at our center when trying to help a patient decide or see where the pain is coming from, and therefore where the massage is going to focus, though not always focused there. So that's therapeutic massage, and reflexology. This is an area that I have a lot to say, and I will try and keep it short. There is beginning to be mounting evidence, of course, just as Dr. Welsh alluded, in each cell, you have all these things that you eat, and they become nutrients, and they feed each cell. And in order to help the cell of a patient who has an injury, you really have to think about which nutrients can help to decrease inflammation, improve and decrease oxidative stress, improve the ability to heal or to use nutrients. And that's why researchers in this field have focused on these big bolded nutrients, omega-3 fats and zinc, vitamin D, B3, vitamin E, and creatine. And then also they are starting to hone in on some herbals. But let me back up and say one thing as a dietitian. You got to be careful that a person doesn't just focus on one nutrient and think that that's going to solve everything, because first of all, that nutrient gets spread throughout the entire body and it gets diluted by everything else the person is eating. And the thing I really want to say is that assumes that all the other required nutrients are available for that person, that they're eating a well-balanced diet, that they're well-fed, and that they're well-nourished. And in fact, one piece of literature suggested that many of these patients with TBI are not well-nourished. And so it just undoes trying to focus on one of these. As I went through the literature and looked, and you'll see here in parentheses, because I wanted to make sure it was available, we know that omega-3 fats are helpful, and most people add fish to their diet in order to make that happen. Zinc is often going to be found in things like fish and plant foods, and that has been seen to be helpful. But you start to see in parentheses where I put the word rats or maybe mice or animals. Much of this has not been tested in a TBI population. It's really not ready to be tested. It's only being tested to understand how it acts in an animal model. So each of these nutrients comes from a cross section of foods. That's why I put that picture up there with all the different foods and all the different colors. And I would suggest that if someone's interested in maximizing their whole body for healing, that they sit down with a dietitian and really talk about what they're eating and how they can enhance it. So having said that, I'm just going to say creatine does seem to have an impact. Again, some of it is in animals, some of it is in humans. It does seem to act as an antioxidant and maybe decrease some post-trauma challenges, especially though found in animals, fewer studies in humans, but the studies are ongoing actually. And curcumin is an anti-inflammatory. It's found in curry-based foods. Again, it seems to have an effect. It decreases inflammatory states, which you really want to do. But unfortunately, most of the work is still only in animals. So Leah, I'm going to ask for your help here in case you have any comments. This information will also be demonstrated and given to you in an experiential way next week with our nurse practitioner, who will walk you through probably some mindfulness and breathing techniques. Most of the work that's been done has not been well controlled, but we have seen this improvement in fatigue and depression most of the time in the studies that seem to have good design, okay? One paper really went into great detail about relaxing and relaxation techniques, and they weren't specifically focused on TBI, but they were focused on trauma patients, and that can include a much wider range. But what has come from all this, whether it was relaxation techniques of just breathing and relaxing, or mindfulness, which becomes becoming aware of what's going on with a person without judging it, or deep breathing, which really relates back in outcomes to the relaxation techniques, or yoga, which is an intentional movement of the body in a specific way with breathing techniques and relaxation. You begin to see that the literature is showing great improvement in things like emotional regulation and our ability to be less stressed and lower our heart rate and blood pressure and muscle tension, even improves things like sleep, which are very important. Leah, would you like to say anything here?
I will say that I talk about most of these applications with most of my patients. I think I've gotten a lot of benefit in my life from things like yoga, and there's a lot of support in the literature for things that I see for yoga. I really caution people to find someone that they trust, whether it is someone who's guiding them through some mindfulness meditation or relaxation techniques or yoga. I really try to caution people to stay within their comfort zone. And I talk to most people about using something like Tai Chi or Qigong, which in my experience, and Diane, you can speak more to this, is a little bit more focused on slow, gentle, safer motions, movements, in a way that I don't see a lot of people practicing yoga in the mainstream.
Yes, I agree. Most of the time, Americans see yoga as an exercise, and actually they just focus only on that part, and they miss the mindfulness or the relationship of mind and body in that way. Laurel, would you like to say anything about this particular area?
I would just say that I think that there are there's lots of opportunities to access these things all across the community. And as Dr. Welsh alluded to, I think finding a place that you feel comfortable with the practice and that is not pushing you in boundaries where you are, not respecting the capacity of your physical being. We have some online yoga options available that run for 10-week sessions. Particularly, the one that comes to mind for me is the one that Susan Cunningham teaches for us on Fridays. She's a nurse and has made a lot of different types of accommodations for various physical limitations and or abilities for that particular patient or patient population that she's working with.
Yeah.
I think finding a place that is familiar with some of those limitations, like some of the providers that practice at CIM, is something that I talk to patients about a lot.
Yep. You guys asked, or someone asked about music and art therapy, and there actually are some studies, few, but there are some studies that are available that show the improvement of music therapy. And let me say this, it is not just listening to music. It is more intense than that. It is therapy where you are either singing or playing or listening, and you become actually active during that. So you can see that's why there would be, because they were active, improvements in the speed of their walk, in the length of their stride, and in how often they could move. And also in the brain, there were improvements in the ability to focus and follow directions and handle emotions from the music therapy studies that were found. And then interestingly, art therapy was combined with psychotherapy, and it was done a couple of times over a 4-month period of time. And again, a sophisticated design. It wasn't just drawing it, it was really gathered with psychotherapy, but significant improvements for the patient because there was an ability to adapt to what was happening in their life with greater awareness and less emotional challenges. They became more emotionally self-regulated and auto-regulated, plus fewer symptoms of depression and perceptions of physical problems. So both of those, very wisely, you asked about those, and there is mounting literature in humans that suggests that these are beneficial. And we at Integrative Medicine, again, because we look at the whole body, mind, and spirit, we are always looking for new ways, and of course, looking at the literature to see the evidence. If you wanted to go to the site at the National Institutes of Health, it's listed here at the top. It's pretty easy to find. These are the references that we used, or there might be some on slides that I couldn't fit in there. And so that's kind of what we wanted to present, and hopefully open you up a little to maybe having some questions for us. So I will stop sharing my slide. By the way, just remember, next week is your time to experience some of this. What questions come up for all of you?
Well, thanks so much. I knew we were going to have questions right away. Michelle, go ahead. You're muted there, Michelle.
Yeah, hang on. Okay, can you hear me?
Yep.
Okay. I noticed on the slide about massage therapies that it references kind of like mild to medium TBI. Is that because there's no research that's been done for, the worst kind of TBI? And do you think that it would still help? I'm guessing it would still help. Or serious, the worst kind of TBI.
I have something to say. I'm sure Diane will as well. I think you're absolutely right. And this kind of goes back to what Diane was saying earlier. It is easier to find changes in patients that have mild to moderate TBI symptoms. It's easier to get funding for results. The last study that I mentioned on my slide, the case study that looked at 2 acute TBI patients with the application of manipulation in the hospital, those were described as pretty severe injuries. And I think that case studies are maybe less confined to that. This is the patient population and we want to see results with this intervention. It just kind of describes what happens to one or a handful of folks. And you said something at the end of your question that also made me.
It was, do you think that it also helps? I'm assuming it does for people that have the serious TBI. Yeah.
My bias is that it does.
Yeah.
It's
That's what my bias too.
Yeah.
I can believe it.
Yeah, bodies appreciate touch, and usually bodies that have a harder time handling touch,
Mhm.
it's for some sad and dramatic reasons. And yeah, I think that touch is so important, massage or otherwise.
Thank you.
Good question. Thank you.
Great. Anybody else have a question? All right, I don't see anything in the chat just yet, so I'm going to ask one. I think overall, I'm curious to know why you all think that there is a growing appreciation for complementary or integrative medicine. It just seems like over the last 10 years, people are really starting to embrace it. We see in this series, people are recommending yoga, recommending mindfulness, meditation quite a lot. It's coming from different types of people. And so just, since you're sitting smack dab in the middle of it, what's your take on why this is really catching fire?
Great question. So I'll start and you two can chime in. Part of the reason why this is getting so much attention, well, there's so many reasons. The trends have just continued to run upwards of the use, and this has been assessed since 2002, I believe, maybe even before that, the trend of use of these different therapies, number one. So back in President Clinton's day, actually, there was this Office of Alternative Medicine, and he was basically like, guys, people are using this. We've got to understand this as scientists. We can't, there's more and more people using all this stuff. So they started to put money into the research of it. So that's really one reason, is it's skyrocketing. Second reason, and this is quoted from, not really quoted because I don't have a quote in my head, from one of the docs who's a very big proponent of it, is that people in our society have found that medicine is dehumanized, and these therapies rehumanize medicine. It brings back touch. It brings back that addressing the full person, not just the physical body. It's not reductionist, as Dr. Welsh was leading to. And then the other thing I want to say is burnout in the population, in physicians, in frontline workers, and especially because COVID has really put this in our face, has really lit a fire under these things. All of us recognize it and are now ready and willing to go there. So that's my take. What else do you two have to contribute?
I can go next. I mean, I spend a lot of time answering phones and talking to patients and helping them navigate our services throughout the clinic. And I think the thing that I hear the most is that, just as Dr. Habash alluded to, they are seeking a holistic approach to an individualized care, not some, they don't want pills. Patients are seeking an opportunity to regain control, have some autonomy with their health care. And I think oftentimes, you know, patients find themselves in positions where providers, medical providers, are talking at them about what they should be doing with their bodies instead of really taking time to not only provide suggestions, provide, you know, the therapies, but also really sitting with them in those moments and acknowledging the pain, acknowledging the symptoms that they're going through, how they're affecting their day-to-day lives outside of just the physical components, and helping them see through that to things that they can do for themselves that might make them feel better or might, you know, provide some progress for them. I really think it's about the autonomy of really taking things back into their hands and feeling like it's a partnership between them and their clinician versus a, you know, authoritarian style.
We're starting to see more clinicians who want non-opioid pain reduction clinics, right? Dr. Welsh can talk a little bit about that. We want to get away from that opioid thing.
Gosh, those answers were so much more articulate than I might be. I really, and I think to just kind of add on to Laurel's point, I think there are a lot of people who are looking for meaning in their conditions. And I think that when you're trained in Western medicine, that idea of rehumanizing the struggle with acute changes in your ability to control your surroundings in your life and the long-term implications of how to manage. I think Western medicine has, to most people's frustration, gone down the road of kind of quick fix. And I think it is unsatisfying for everyone in the relationship when quick fixes don't fill that human need for connection. And I think these are therapies that really try to address some of that and have real physiologic effects that Western medicine maybe hasn't boxed in and explained quite yet.
Okay. Angelique has a question here in the chat. She was asking, since you had been talking about yoga, what are the does integrative medicine offer group yoga classes, or you know, sort of what are the resources that we have with yoga? I know that there's a yoga for TBI group, but in your area, are there other resources?
Currently, we have one yoga practice. We call it Gentle Hatha Yoga. It's all Zoom. It's all online currently and has been for about the last year. And it runs in 10-week sessions. Not that the sessions build upon each other. It's just our way to kind of have people be able to sign up and re-engage with the class. It's offered, we have 3 different instructors, and it's offered 3 different times a week. So we have a Monday daytime class that occurs at about 11 o'clock in the morning, a Monday evening class that's at 5:30 p.m., and then a Friday daytime class that's from noon to 1. And our instructors have been with integrative medicine. They've actually been with integrative medicine for about the last 4 years, but prior to that were instructors within the pulmonary clinic next door, and did some things with that staff. When that staff gym was in the Martha Moore House, they did some yoga classes through that space. Friday's classes I was mentioning is Susan Cunningham is the name of our instructor, and she was a nurse by training. And so I always sort of give her lots of kudos because I think she does make just such great accommodations for patients. We've had several different instances where patients coming out of like cardiac rehab and they want to get into something that's a group class, and this atmosphere allows them to really identify what their capabilities are. And then Susan also provides them with like, okay, if you can't manage this posture, here are some alternatives that you can do that'll still allow you to be safe, really provide that good base training. And then they can go out and participate in group classes throughout the community and know really what their boundaries are and how to make those adjustments to still stay safe and respect their own physical capabilities. Our class pass is $100 for that 10-week session. So it breaks down to about $10 a week. The patients or participants, it's a community class, so you don't have to be a patient of integrative medicine to participate. They can choose whichever one class that they would like to participate each week. So if Monday works this week and next week it's Friday that works better, you have the freedom to kind of bounce back and forth and have access to those classes.
And if we want to get involved in those, is there a central email or?
Yeah. Yeah, I can send the link over to you, but the classes are always posted on our website, on our integrative medicine website. Once you go under classes, you'll see them located there. Our next session will begin at the end of June.
All right, I'm writing that down. Okay, any other questions that are out there? Michelle, go ahead.
What? Did you say
Go
me?
ahead. Yep.
Oh, okay. I didn't know if anybody else raised their hand. Okay. All right. So I have a question about the music therapy, and I'm very interested in that. And I noticed you mentioned there were 6 studies, I think. And I'm curious though about maybe how far you've gotten at OSU with the music therapy for TBI.
Well, we don't have music therapy currently at Integrative Medicine. I don't know if you have it, if you guys have it, Kedar, in your area.
Yeah, so we've done a couple things with music. We have a couple researchers, one in the Department of Music Education, actually, and then we have someone in physical medicine as well, and they're using different aspects of music. But in the studies that we have that we've been funding, it's really about looking at music and dance in combination. So, and trying to tease apart which one's working, which one's the chicken, which is the egg, because it seems like it's great when you have dance and music. And I once went to a dance instructor and I said, well, you can't have dance without music. And she told me that that was absolutely wrong. And I learned for 15 straight minutes why I was wrong. So you can't have dance without music. And so it's just trying to dissect which of these things is working. But the idea is, if you have music and you have dance together, can you improve mobility faster than physical therapy alone, or whatever intervention you might be on years after your injury? So those are still ongoing, but the anecdotal evidence is that music is pretty good for you. Dance is pretty good for you. That participation is really good. And when you're dancing in some of these modalities, you're dancing with a partner, and that partner may be your caregiver or your spouse or a friend. And so it's also, there's this social component to it. There's a touch component to it, right? So as we said, if bodies are starved for touch or respond really well to it, which part of it's working? It's really hard to figure that one out. Probably the quick answer is it's working, right? And so that's good enough to at least give it a shot. So that's some of the stuff that we're doing, Michelle.
Okay, thanks.
You're welcome. And so on that note, I just want to make sure that I bring this up. So in the fall, we're looking at our October schedule right now. Or rather, we're looking all the way out until next May, actually. But in October, we're thinking about doing auditory issues. I know a couple of people had talked about like ringing in the ears and things like that. And so we thought, we can talk a little bit about some auditory issues, but we could also talk about, things that are positive that involve hearing. And so we're going to bring in some music therapy there. So we may even talk about the study I just talked about at that session. So October.
That's great.
Any other questions out there?
You know, I want to say something about music and Tai Chi and Qigong, because the students in Tai Chi and Qigong, when COVID impacted us and we had to move from doing those classes at the studio, at the clinic, to going online, one of the biggest challenges was not having music anymore. And they noticed it. They said to me, I don't like doing Tai Chi without my music. So music is soothing and healing in many ways. And while Ohio State is trying to differentiate the movement versus the music impact, I think for almost anybody, it can be soothing, and it can also be rejuvenating because we know there are studies in, I believe it's Alzheimer's and dementia, where music was played for people and they actually became alert to their surroundings with the music of their era because they recognized it, their brain recognized it. So music is a terrific therapy, and it's nice to use. I use it all the time.
I agree.
This has been fantastic. I really appreciate the information. And Kadar, this is what I was hoping to hear when we talked last week. So, or a week ago, 2 weeks ago. So thank you. I very much appreciate this. And I've sent you a note separately about getting some additional stuff from you.
Sounds good. Well, I'm glad we were, on target for you.
Yeah, absolutely. Very, very important and much appreciated.
Sure. So I've got a couple more questions, I think, as long as there's not anything out there, but if you've got one, you can feel free to just jump right into mine. So I have a lot of questions about the research, right? There's a lot of research potential, and probably this is an offline conversation because there's, my head can go in a lot of different ways with this. But that's kind of the question, right? There's so much room. If we kind of looked at it as, here's the voice of the customer in the room, right? We have a number of survivors here that are, able to tell us, what they might like or not like. I'm just curious to know what modalities, right, of integrative medicine would be a good starting point. Where do you see the fit between what is not known and needed, as well as what is feasible for us to test and do in a way that's, really helpful for the community?
I have an opinion, but I think Dr. Welsh can go first.
Oh, please go ahead.
Well, to me, Kedar, I think one of the things that I always think about, and I was trained in research, is accessing the low-hanging fruit, right? And at Ohio State, some of the lowest hanging fruit has to do with mindfulness, because we have already packages of mindfulness in motion. And we know from other research around the country that functional MRIs can show impact of mindfulness training. So for me, that's a pretty low hanging fruit. We have the packaged program already, and we've already done functional MRIs, and we know there's proof. I would say, what is that capability like? That comes up for me first.
I also think that some of the challenges that we face are things like with massage, particularly, is you have, I have 2 massage therapists that today would jump into that pool to say, oh, we want to do research, all in and ready to go. But the challenge is that their practices on how they deliver the objective pressure of massage therapy for each of these patients, how the patient perceives that pressure, is it the same? And then really being able to package it in a way that is, truly a blind study, or that there's really that scientific evidence there. How do I know that massage therapist A and massage therapist B are applying the same techniques with the same pressure to the patients, and that the patients are perceiving those things in the same way?
You just nailed why there's not a lot of research studies in massage.
But we do
What
have
about
some
you?
oh, sorry, go ahead.
Sorry. No, go ahead, Laurel.
I was just going to say that one of our massage therapists, Michelle Mack, she's an instructor for the massage therapy program at Columbus State and is very technical about those terms and about the applications and how she utilizes that with her patients. I can think, Ron Hill is the same way. He's been a massage therapist for nearly 20 years and was a medic before. So when he is applying that knowledge and combining it with the type of therapy that he provides, he's very tactical about that. And I think as a not to veer away from the research question, but just to say, like, as a consumer, if you were going out and seeking massage therapy services in the community, I would really focus on asking, what is the medical background? What's the medical understanding for those particular massage therapists? All massage therapists that work anywhere from Massage Envy to Ohio State Integrative Medicine should be licensed massage therapist with the state medical board, but not all of them have the continuing education and the true interest in applying these things as a therapy.
Fair point. Leah, any thoughts?
Some of the things that I'm thinking about are sitting near Laurel, typing my notes and listening to her conversations with insurance companies on coverage of acupuncture. And I think that kind of encompasses some of the low-hanging fruit type question. Like, this is a modality that so many people have found benefit in. There's a lot of kind of roiling interest from a Western medical perspective, and how is this even working? And I think this is not going to answer your question, but these are just some of the things that I think about with coming from a Western medicine perspective. And, I think trying to tease apart if music is the thing that's helping, if dancing is the thing that's helping, if that social interaction is the thing that's helping, is the same issue with, some of the things that Laurel mentioned about massage, and thinking about an entire philosophical approach to looking at a body in an idea of nature as ancient, as Ayurvedic medicine does, as traditional Chinese medicine does. There's some overlap with Western medicine. And I think it also is imperative on Western medicine to start looking at, okay, well, how important is it that massage therapist A and massage therapist B are putting in the same pressure? And let's look a little bit more holistically. What can we learn a little bit more holistically, a little bit less reductionistically about how this is affecting this patient in his or her or their environment? And I don't have any great answers about that. And I think that there are some great things that academia has achieved and put forth through that reductionistic approach. And I just think that it would be worthwhile to look at what are some of the ways, all right, some of these modalities don't necessarily fit into, this is how we research a pharmacologic approach to a problem. This is a different layer and level of approach than a biochemical approach. And I think we need to have more of those conversations, as well as we're looking into how can we prove this is helpful for people.
That's a good point. I mean, it's got to come back to, is it going to help, and how do we get people to it, right? I think all three of those are things that I want to have conversations with you about. So I'll definitely be following up.
I would love to be a fly on the wall in that conversation.
Yeah, well, I think as we mature it, it would be something to think about, because we would have to recruit people into those studies, and so one of the things that we like to do with this program is just make you aware of the opportunities to get involved with research. So
fantastic, thank you.
Maybe some ideas there. There was a follow-up question about Diane, what you had said about mindfulness and motion being sort of we have this packaged program. Can you talk a little bit about what mindfulness and motion is?
Sure. Mariana Klatt is a professor in family medicine, and years ago she studied under probably one of the most world-renowned gurus in mindfulness. His name is Jon Kabat-Zinn. He created mindfulness-based stress reduction at Harvard in patient clinics in 1979 and has run those, or his successors have run those ever since. And there's a significant amount of research on what mindfulness does. And other researchers around the country, like Richie Davidson from University of Wisconsin-Madison, has done functional MRIs to see the impact. And basically mindfulness is paying attention to the present moment without judgment, just to understand and see what the present moment is, observing it, and then learning how to do this and learning how that impacts the emotional self and the psychological self and even the physiology. There's significant researchers on our campus who study the impact of stress on physiology. Mariana is one of them. And when she studied under Jon Kabat-Zinn, she came back to Ohio State. And I only know this because I was in the Clinical Research Center where I was helping on the other end to facilitate her research. She created, instead of a 16-week program, she created an 8-week program, and she tested it, and she found the same markers reduce, like blood pressure and heart rate and cytokines, inflammatory chemicals, and epinephrine and cortisol. These slow down and decrease over time. The person just gets better at handling stress, whether it's their own internal thinking of things or external stress that comes to them, because they practice this mindfulness process. Now, it's gotten a lot of attention over the last 20, 30, 40 years. And sometimes Kabat-Zinn calls it MIC mindfulness because so many people are applying it in so many ways. Well, Mariana took this, and not only did she test it in a group of nurses in the ICU and firefighters, but then she created a process inside Ohio State where in the last 3 or 4 years, she's been testing this in an 8-week program across medical center employees and has found significant help by just teaching doctors, nurses, people like all of us, how to handle, how to be mindful, and therefore how to recognize stress, and not that it's, listen, not that it's an end all be all, but basically it is a way to recognize what's going on with us in the moments that we're able to do that. And so her program, she uses motion. So she uses some yoga kinds of things, but she also uses just simple sitting meditation or closing your eyes and using breath and so on. And it's already packaged. It has videos with it. It has weekly practice. It has things to read. It's in a packaged kind of format. And it's been tested on, I can't tell you how many hundreds of medical center employees and staff.
Is that available to, folks that just are interested to give it a try?
I don't think it's freely available, no, but we can ask her. I don't know what her intentions are exactly to make that freely available, but it is available probably to be purchased, as a group or something like that. That's a great question. I don't know. Do either one, Laurel, do you know?
I think, so if we're talking about OSU staff, providers, KDAR, yes, the answer is yes, that it is openly available to any OSU clinician, administrative personnel, and Amanda Blake would be the contact for that. They are constantly recruiting for their cohorts, and it's an 8-week program that she puts you through. And I think that I think that that's a part of her aspirations, is to develop it as a package that would be available to entities outside of faculty and staff at Ohio State. I know she recently did the study with the Ohio Hospital Association that included 3 different hospital systems. And I think that is her long-term goal, that this will be available as something that we could offer.
All right, so a little bit of stay tuned, and maybe we can do some digging and see if, what are the circumstances in which
Right.
we, connect you to it. So, um,
But I will say there's lots of mindfulness resources on our website.
Mhm.
That's not necessarily the mindfulness in motion, but there are mindfulness guided meditations and mindfulness on our website for, lots of different circumstances, for managing pain, for grieving, for anger issues. There's a mindful parenting. There's 2 4-week sessions that we recorded and have it on our website for mindful parenting. The first part is mindful parenting. The second 4-week session is mindful families. And we really did that trying to help everyone that was, stuck at home under the roof with children of varying ages and, not having a ton of outlets. So that was a very good resource, and I would encourage everyone to check that out.
Very good. And I'll add that we also had a research study, a very small one. I don't know if we were able to recruit to it very well, on mindfulness, as part of I think it was a group mindfulness session for survivors of TBI. And so, we had we started running that in fall of 2019. And so obviously things got derailed. And so, we'll have to check back in to see, where are they at with that program? And if they're continuing to recruit, we'll certainly send you the information. We're a little over our time, but if there are questions, I'm happy to just, quickly get to those. Does anybody else have a burning question? And arms jumping out of sockets here. So I'm going to ask one last question. And it's one that I feel like we come to a lot, in that getting access to care can be gated, right? And so getting, your clinical partner on board with anything that you want to try can be difficult, especially as a TBI survivor. This is a pretty common refrain. And alternative and complementary therapies, I think, are also hard to get access to because people are just not as familiar with it. So when you think about, you've got terminology like somatic dysfunction, for example, I wouldn't know quite what that means in the specific, OMM. So how can these things be challenges? Is there language that we should be using when we're trying to get access to these things? How can you sort of combat potentially, your primary care physician thinking this is not good for you? And maybe as an extension of that, just in general, how do we access these kinds of services?
I will say I feel like I have been getting referrals, the idea that your primary care physician doesn't think that any of this is a good idea. I will say I don't run up against that very often. I probably don't run in a lot of circles that thinks what I do is dumb. I think I've gotten referrals from the spine center, from various folks in the Department of Family Medicine, ortho, folks from pelvic floor physical therapy, folks from general physical therapy. I feel like some folks know who we are and send patients in.
Is it me, or are we getting some lag?
Yeah, we were having some lag there.
Okay.
I would say, as far as access goes, I think some of the things, I don't necessarily think that there's a language, but I do think there are some misconceptions about, what integrative medicine can do. So I think, if you're focusing on really trying to get a patient to where, their attempt is to achieve their optimal wellness or whatever that looks like. I think just really trying to identify what does that mean. So sending us someone that just says wellness, there's this whole big capacity, right? Of like, what does that look like and where do we start? And I could have them see a chiropractor, a massage therapist, a DO, an Ayurvedic specialist. But is it the pain that's really, causing disruption into their lives that helps us be more targeted about where they should start and really allows the patient to get the best impact on their time, for them, what they're coming to see. We're not wasting their time. We're not wasting the clinician's time. But really just being, targeted about what the patient needs assistance with. What is it? Is it, like I said, is it pain? Is it the spasticity? Is it foggy brain, cloudy thoughts, just specific so that we can help get patients to the right place so that we are thoughtful about their time.
So Laurel, does that mean that, if I come to integrative medicine at Ohio State or maybe even another site, that I might expect that it's sort of a team focus in some sense because I'm being directed to the right place, but I might be able to combine those therapies or sort of get that personalized fit. Is that your approach to it?
Yeah, most definitely. I think when I think about patients that come in, if it is oftentimes we get lots of referrals and we start with somebody like a Dr. Giles, who's an MD. She's been an MD with us for, 5 years at this point. She actually worked with us a long time ago, back in 2005 as well. But so she is very good at listening to patients, really getting to the root cause of what brought them, what started them seeking out integrative medicine services. And then she would make referrals, whether that's to Dr. Welsh or Dr. Shake for some sort of osteopathic manipulation, or if acupuncture is a better fit, just based on, are they having neuropathies or are they having joint pain, just those types of things. So yes, to answer your question, I feel like there is a tailored approach for each patient that might consist of multiple different modalities.
Very good. Okay, so we're quite a bit more over time. So in the interest of, just respecting our presenters' time, I think we'll wrap up today. But we will be back next week with more members of their team I'm looking forward to this more interactive experience as well. But I think there's a great learning session for us. So I think what I'll leave it with is, if you have questions about integrative medicine at Ohio State, you're welcome to email me and or go to their website and get in touch with them directly. But that way we can sort of aggregate and see what the interests are. Maybe that informs some of the research and things that we do going forward. So otherwise, we'll be back here next week at 6:30 on Wednesday night. But again, thank you to Diane and Leah and Laurel for coming out here and giving their time and doing a wonderful job to help us understand more about it.
Thank you very much. This has been awesome.
Thank you.
Take
Thank you
care.
very much.
Yeah, thank you.
Thank you. Bye.
All right, folks, have a good night.
You're welcome. Bye-bye.
You too.